It is so common that up to 15–20% of all the men in the world have it. Hello, my name is Giangiacomo Ollandini, and I'm a urology consultant in London and in Milton Keynes. Today I'd like to talk about a condition that is very common. It is so common that up to 15–20% of all the men in the world have it. But there is a selected population where it is found in 40% of men. And this is the population of the men suffering from male factor infertility. I'm talking about the varicocele. What is the varicocele? Well, from the name, it's quite similar to the varicose veins that are found typically on the lower limbs. And in fact, is again a dilatation of the veins. It's a dilatation of the veins that drain the blood from the testicle upwards, so non-oxygenated blood going upwards. And it affects almost invariably the left-hand side. That is due to certain anatomical reasons. We are certainly symmetrical from the outside, but inside the organs are all displaced. The heart is on the left, the liver is on the right. And that's the reason why the varicocele happens most of the times, in the vast majority of cases, on the left-hand side. In some cases, on both sides, and in very rare cases, on the right. By the way, if you happen to have an isolated varicocele on the right, make sure that you urgently contact your physician, your GP, because that can be a sign of concern. Why is the varicocele so important? The varicocele is known to be the most common surgically correctable cause of male factor infertility. And that's because of this reflow of blood. When the dilated veins are not working well, the blood is going in the wrong direction. So it's impossible to believe that 15–20% of men in the world have a severe condition or have problems with fertility. And in fact, it's absolutely not true. Having a varicocele doesn't mean needing a treatment. The varicocele, however, can come with two problems. The first problem is that it can be cause of pain or a dull ache or some unpleasant sensation after walking for a long time, and especially in the warmer climate or in the warmer days when it's summer, for example. It's not surprising because that means the veins are more dilated, and that means the varicocele becomes slightly more severe. It's not very common, but it is something that I do see quite often. And the second problem is that the varicocele can be associated to reduced fertility and to impaired results in the fertility test. If one of these two conditions occurs, then there is an indication to treat the varicocele, so that hopefully the pain will go away and hopefully the seminal parameters will improve. That is not enough to say seminal parameters will improve and therefore fathering will certainly happen. Unfortunately, this is not true. But improving seminal parameters certainly helps in having more chances. Treatment of varicocele have been described in the last century in a variety of different forms. But nowadays, we are down to two approaches mostly used for treating the varicocele. One is a non-surgical approach, one is a surgical approach. The non-surgical approach, that very often is the first one attempted, is actually performed by the interventional radiologist. It's a colleague specialized in radiology that has an operative action and basically consists in going to close the vein from its inside, typically passing either from the other side, cannulating a vein and with X-ray guidance going through the vein in the body internally with tiny probes and catheters and guide wires, and then deploying some metallic coil or some sort of glue that closes the veins from the inside. And this is the retrograde embolization or sclerotization or scleroembolization of the varicocele. And the surgical one is the microsurgical ligation of the varicocele. Of course, non-microsurgical techniques are also available, but there is quite a robust evidence to demonstrate that the microsurgical approach is by far the safest and the most effective one. How is that done? Well, it is done delivering a structure that contains all these veins, that is called the spermatic cord, with a very small incision, a couple of centimeters, no more than that, just at the base of the scrotum in the lower part of the groin. And then this is carefully opened, and with a microscope that has the power of magnifying everything in the operating field up to a certain amount of factors, can be 10, 20, with this microscope manually identifying each and every dilated veins, finding it, isolating, closing, so that they are sorted. And also with the microscope, identifying every other structure that needs to remain intact and keeping it safe. This way, there is a good chance of correcting the varicocele with the minimal chance of having risks and side effects and postoperative complication. Certainly, the surgical option, so the microsurgical option actually, is much more time consuming, requires more skills because requires the use of a microscope, and is done under general anesthetic. So that is quite more impactful than a more simple procedure as the embolization. In fact, the embolization is done under local anesthetic and is quite fast. But they do have a different degree of effectiveness, with the embolization having a ratio of technical failure that is around 10-15% as a standard. And the microsurgical varicocele correction is far more than 95% of success. On top of that, very recently, some newer parameters for checking how the fertility is, DNA fragmentation, oxidative stress, that are all related to the quality of the semen, have been linked to the varicocele, so that there are new indications for treating varicocele. That means that even patients with a normal fertility test, if they suffer from couple infertility, and if there is a demonstration that DNA fragmentation is high, can benefit from having a varicocele corrected. So if you find yourself with a sort of dull ache or heaviness on the left-hand side, and you notice that there is some awkward lumpy feeling on top of the left testicle, that could be a varicocele. Check it with your GP, have a discussion, or book a consultation.